and I am Michelle Marisi, licensed acupuncturist and practitioner of Chinese medicine based in the greater Providence, Rhode Island area. And let's get started with our final Intro to Tongue Diagnosis video. So just to review the signs of a healthy tongue, you can always look at a baby for reference. It's like a pink color, smooth texture with a rounded tip, no cracks, a moistness to the tongue, neither very wet nor dry, and a thin white coating, which is easier to notice once you start looking at more tongues and you see what a tongue without a coating looks like, or a tongue with a thicker coating looks like. And kind of thin pink sublingual veins that just more or less kind of blend into the underside of the tongue while still being somewhat visible, and a lively movement to the tongue without being out of control or like just kind of flaccid or stiff, just a nice happy medium. And this is the map for the tongue in Chinese medicine. So each part of the tongue corresponds to a different part of the body and specifically an organ. So you can see that organ key or that abbreviation key off to the side. So, but generally the top part of the tongue towards the tip is associated with what's called the upper jiao, the organs of the chest, the heart at the very tip, and then the lung a little further back from that. And then the middle of the tongue is taken up by the earth and wood organs, so the stomach in the middle, the spleen on either side, and then usually it's just the liver that we think about with the sides of the tongue, but some people, some sources say that the left side is associated with the gallbladder, some say the right, so, but typically we're thinking about the liver when we look at the sides of the tongue. And then the back of the tongue, we're mainly focused on the kidney, but that reflects the health of the lower jiao in general, so the kidneys, the bladder, and the intestines. So we have been talking about in the previous classes different qualities of the tongue that we look at and what those qualities signify. And so now we're going to put together certain qualities to see how a certain pattern of disharmony presents in someone's tongue. So if you're unfamiliar with the general patterns of disharmony in Chinese medicine, we will probably do some classes going more into that. You can also refer to the Intro to Pulse classes that I did, which are also on Dr. Wu Healing YouTube channel, for a little more on the patterns of disharmony. So first we'll go through how deficient conditions present on the tongue, starting with yin deficiency. And so in general, I've bolded the qualities that are most common or that are most distinct to each pattern. But in general, a yin deficient tongue is going to be red and peeled. So red in color and peeled meaning there's no coating or there's little coating. On a more rare occasion, you might see what's called a geographic coating we talked about in earlier classes, like a patchy coating. And another hallmark sign of a yin deficient condition is a cracked tongue. So most often there's a midline crack right down the center of the tongue. Depending on how far it goes, can show kind of how severe the yin deficiency is. Sometimes the crack will only be in the upper jiao part of the tongue, so it's more of an upper jiao, like a heart yin or a lung yin deficiency. Most often you'll see a crack in the stomach coming down, like from the back of the tongue through the stomach area. So stomach yin deficiency, or perhaps a kidney yin deficiency, which is more of like a systemic yin deficiency. And so a red cracked tongue with a little coating or a completely peeled coat is someone who is yin deficient. And the movement of the tongue is not as relevant. The condition of the sublingual veins is not as relevant with looking for signs of yin deficiency. The shape might be narrow and maybe even tapered, which is signaling more of an upper jiao yin deficiency. So again, the heart, lung. And the moisture level of the tongue might be more commonly be dry with yin deficiency. Unfortunately, you're usually not going to see textbook tongues, so to speak, so nothing exists in a vacuum, so you'll usually see kind of combinations of patterns, or it might have been, someone has a historically damp constitution, and then over time that turned into somehow yin deficiency, and so they have different almost conflicting qualities. So, but to start, just to know the general look of a yin deficient tongue, I think is helpful. And if you do see a tongue that matches all these, then that's a good way to kind of learn, and you can perhaps ask into that person's any symptoms or issues they may have. Do they have trouble sleeping? That's pretty common with yin deficiency, particularly staying asleep or high stress. So to see if it goes along with a yin deficient constitution. And moving on to a yang deficient tongue. So this tongue is going to be pale. It will be maybe puffy or swollen in shape, so the tongue's not really holding its shape, and the moisture level would more likely be wet. It's certainly not going to be dry, and the movement might be kind of limp, lackluster. The texture and coating will probably be normal, not cracked, certainly not peeled in coating, and the sublingual veins are not really relevant, but perhaps they may not be as visible on a healthy as they would be on a healthy tongue because of this kind of swollen nature of the tongue. So for this, you want to see those qualities in combination: pale, puffy or swollen, wet, kind of a limp. And this person is going to be very tired. They're going to be probably not very talkative, and just exhausted. So all that in combination hints at yang deficiency. So this is, or more specifically, kidney yang deficiency is the systemic form of yang deficiency. So you might have any of these conditions specific to different organs, but we're talking about like systemic yin deficiency, yang deficiency, etc. And moving on to a blood deficient tongue, the key factor is that it's pale. It may also be thin or even flat looking, like it's been run over. That is more rare, but certainly some people have tongues that look a little thin. And if it's also combined with a pale texture, a pale color, you know that they are blood deficient, not having enough blood to kind of fill out the tongue and color the tongue. The moisture may be dry, and the rest of the qualities are either going to be normal or they may not be, signaling some other pattern of disharmony going on. But pale and thin are the key factors with blood deficiency. And again, if you are familiar with the symptoms of blood deficiency, you might ask into whether they have, for example, trouble falling asleep. So trouble staying asleep would be yin deficiency, trouble falling asleep, blood deficiency, maybe some anxiety or restlessness, maybe some menstrual symptoms, like that are more significant once someone has started bleeding. If they're blood deficient, then when they're starting to lose blood, the symptoms will be more pronounced. Maybe they have dizziness or postural hypotension, so when they stand up, their vision kind of just takes a moment to come back to them. So those are some signs of blood deficiency, and dryness in general, not just on the tongue, but the skin perhaps, are signs of blood deficiency. As for qi deficiency, that's also going to be a pale color to the tongue. Scallops, a scallop shape is a good sign of qi deficiency, very common sign. It may also be swollen or puffy, but definitely pale and scalloped signal qi deficiency. And again, we talked about scalloping in previous classes, but just to refresh, that's when you see the teeth marks along the sides of the tongue, like there's not enough qi to keep the tongue in its form, and it presses up against the sides of the teeth and molds to the shape of them. So that those two qualities, pale and scalloped tongue, are definite signs of qi deficiency. And the movement may be tremulous, so like there's not enough energy to kind of have more control over the tongue. It's shaking a bit. And so those are the deficient conditions. And now moving on to excess conditions. So yin qi, or full cold. I think this is probably more rare, certainly from what I've seen, more of a rare condition. This would be like with someone they've had like a cold invasion, where perhaps they've been in an acute situation that introduced cold into their body, whether it's a cold environment or maybe some kind of medical treatment or medicine that was really cold. For example, antibiotics tend to be cooling. So the key sign for this would be a thick snow white coat. So this is a sign of excess and cold. The thickness of the coat and the snow white coloring signals cold. The tongue will also likely be pale, perhaps swollen, puffy, or scalloped, wet, and with that thick white coat. And as for a full heat condition, or yang qi, the key signs for this would be a fully red tongue with a thick yellow coating. So rather than a thick white coat with cold, you're going to see a thick yellow coat for heat. So that's full heat, and damp heat as well. It's a and or called damp heat. So the thick coating signals dampness, and the yellow signals heat. And the red also, of course, signals heat. The moisture will be dry, and they may also have bad breath. Just a note from stomach heat in particular causes bad breath. So this and this person will likely have like a red face. Maybe they eat a lot of fried foods and drink a lot of alcohol. Those are very heating in large quantities. Definitely very heating to the body. And blood stagnation. So the key factor with blood stagnation is a kind of a purplish color to the tongue, so a dark color to the tongue, and possibly it will have spots of darkness, or just fully one color, purplish color, and there may be purple distended, really kind of thick veins under the tongue, very distinct, kind of maybe even like kind of bulbous veins under the tongue, like think varicose veins, but under the tongue. So that's the key sign of blood stagnation, purple. This person's probably going to have some sharp, intense pain that has a specific location, not the kind of pain that moves around, as with chi stagnation, which we'll get to next. So the key with chi stagnation, I think different sources say different things, but what I've learned is that a dusky coloring is the key sign of chi stagnation. So it's not the severe purple of a blood stagnant tongue. It's more like a bluish tinge, and it is, so it's, you can still usually see like that red or pinkish color of the tongue, but with this tint of blue. And the sublingual veins may also have a bluish look to them and a slightly swollen shape. So not as severe as a blood stagnant tongue. And likewise, the symptoms will not be as severe, right? If there's pain, it won't be as severe. It's a pain that might move around, or it's hard to quite pinpoint where it is. And there may also be an emotional presentation with the chi stagnation more than a physical symptom. So frustration or pent-up emotion, or even depression that kind of is repressing anger. All right, so I think this is the last one. So dampness or phlegm. The key signs with this is a thick coating, and the shape would be kind of swollen or puffy, maybe scalloped as well from being kind of oversized, pressing up into the teeth. And the coating color and the moisture kind of depend on whether it's a cold phlegm or a damp phlegm condition. So we know with yellow coating, that's a sign of heat, so the tongue will probably be red and dry as well. If it's a white coating, the tongue will likely be pale with a moist level of moisture or wet. And you may also see these like kind of phlegm strands, we call them. So from the tongue to the roof of the mouth, this as the person's opening their mouth, you see a string of kind of like foamy saliva between the tongue and the roof of the mouth, or it might just, the tongue might look kind of foamy. It may also have a greasy coating, and the texture, the movement, the sublingual veins aren't really relevant with signs of dampness or phlegm. And this person will likely be overweight. So dampness and phlegm, excess, not necessarily overweight, but that tends to be the case. And perhaps eat a lot of sugary or sugary food, dairy, or fatty foods in excess. So those are possibilities. It could be other things. It could have some condition with excess mucus, or other conditions that cause this accumulation. And so these are just some recommended resources for further reading if you so desire. So I always recommend The Web That Has No Weaver as a great introduction to, an in-depth introduction to the theory of traditional Chinese medicine. And it goes into detail on pulse and tongue. And Foundations of Chinese Medicine, that's more of an investment. That's like a textbook, but it does have pictures of tongues that could be very useful. And speaking of which, we'll just go back to the last class's slides briefly to take a look at some pictures now with the knowledge we now have, to kind of guess at the patterns of disharmony of these people. So I don't have pictures that associate with all of the conditions we went over, but at least we can try to apply the knowledge we just learned. So with this tongue, we talked about that it's definitely pale. It doesn't look to have too many other signs of disharmony. Looks pretty healthy. The shape might be a little scalloping, but really not anything significant. So, and the coating does not look thick. It looks like a thin white coating. We can't see the sublingual veins, but this person, and the thickness of the tongue looks pretty normal. Of course, it is easier when you see someone in person. You can see the movement of the tongue. You can have them open their mouth wider so that you can see to the root of the tongue. So a lot of these pictures, we can't really see the lower jowl area of the tongue. But this person looks like maybe a bit qi deficient, nothing major, maybe a little blood deficient, but otherwise pretty healthy. So a mild qi or blood deficiency for this person. And as for this person, maybe more on the blood deficient side. So there's kind of a peachy look to the tongue, which is also associated with blood deficiency, and you can see some really minor cracks down the midline of the tongue. Nothing significant. So this person might be a little more on the blood deficiency side, heading toward yin deficiency, but not yin deficient at this stage. And then this person, we've got a pretty swollen, really deeply scalloped tongue, puffy as well, mostly pale besides the red spots at the tip of the tongue. So that may indicate some kind of heat in the heart. But overall, the pattern here would be a chi deficiency and dampness, I would say. So they have a thin white coat, so it doesn't look like they have an excess condition. It's more of a chi deficiency, perhaps leading to dampness, or dampness. It's a vicious cycle with chi deficiency and dampness, where the spleen can get overtaxed, and so the chi is depleted, and when the chi is depleted, the spleen is not able to transform and transport the food as effectively into chi for the body to use, and so things accumulate and lead to a damp condition. So this person, I would say, is overall spleen and chi deficiency, probably, I would guess, overweight, but can't be sure about that. And let's see, this tongue, we had talked about the coating looks definitely thick. It's not a normal thin or healthy thin white coat. It has a little bit of a yellowish tint, and maybe the tongue looks a little red. It, again, would be easier to see in person, but I would want to ask more into their symptoms and listen to their pulse and determine whether there's some heat, but definitely dampness. The tongue looks kind of puffy, so you can see like these swollen parts around the spleen stomach area. So it almost looks like it's forming a crack, but it's not, I don't think, from this picture, a crack. And from the general look of this person's tongue, it's just this valley between these swollen kind of hills of the middle jowl area of the tongue. So some kind of spleen stomach dysfunction with dampness for this person. And this poor fella has some really severe yin deficiency. So this is a severely cracked, just very raw looking tongue, completely peeled red. So that is yin deficiency through and through. So, and then finally, we've got some blood stagnation here with these distended veins. Okay, so thank you for joining for this final intro to tongue diagnosis video, and please stay tuned for more classes on Chinese medicine diagnostics. Please feel free to reach out to me. If you'd like to request this slide deck, I'd be happy to email it to you or answer any questions you may have. So thank you again, and I will see you next time.